Alpha 2 Pediatrics Department of Bukhara State Medical Institute. Today we will talk about vaccination and safe immunization of children. The fact is, the vaccines save lives and protect against the spread of disease. Vaccines work, and they have kept children healthy and have saved millions of lives for more than 50 years. Most childhood vaccines are 90% to 99% effective in preventing disease. And if a vaccinated child does get the disease, the symptoms are usually less serious than in a child who hasn't been vaccinated. There may be mild side effects like swelling where the shot was given, but they do not last long, and it is rare for side effects to be serious. Vaccines included in the vaccination calendar of the Republic of Uzbekistan are EPR, is a trivalent live vaccine against measles, parotids, and rubella. APDT, HPV, HIV is a pentavalent vaccine against pertussis, diphtheria, tetanus, hepatitis B, and Haemophilus influenza bacil infection. So pentavalent vaccine is for 5 types of disease. Rotavirus vaccine is oral vaccine for rotavirus which is causing intestinal infections. And pneuma is pneumococcal vaccine, IPV inactivated poliomyelite vaccine, HPV vaccine against human papillomavirus, and BCG, Bacillus of Calmette-Guerin, against tuberculosis. Here you can see the calendar of Republic of Uzbekistan. On first day after birth, the child must take HBV1 for hepatitis B virus. Then in 2 and 5 days old, from poliomyelite virus and BCG vaccine. On 2 months, he will take pentavaccine, rota first, and pneuma first vaccines. On 3 months, it will be like same, which in 2 months. On 4 months too, but pentavaccine is taken 3 months. Pneuma vaccines and rota vaccines only 2 months. On 1 year old or 12 months, he will take MPR and pneuma 3. On 16 months, he will take APDT and OPV vaccine. On 6 years, he will take vaccine MPR2. Then in 7 years, again, he will take ADT, OPV. In 9 and 12 years for papillomavirus vaccine. And in 16 years, ADT again. The indication for immunization is the age corresponded to the period of immunization according to the vaccination calendar and the unfavorable epidemiological situation in this country. How vaccines work? Vaccines work by imitating a bacteria or virus using either mRNA or a dead or weakened version of the bacteria or viruses. Every time we take weakened or dead form of bacteria or viruses, the vaccine raises the body's alarm, and it raises the body's immune system too. It trains the body to recognize and fight the viruses. When the body encounters the real dead virus, it is primed and ready to fight for the body's health. Rules for immunization. First of all, vaccination of children is carried out after a medical examination. When selecting children for preventive vaccination, it is necessary, first of all, to assess the general condition of the person being vaccinated. Interview parents or accompanying persons about the child's health status. Identify medical contraindications from vaccinations. and the presence of reactions to previous vaccinations. Here you can see the pathogenesis of vaccines. For example, BCG vaccination. BCG vaccination is taken, then in urine, blood, and serum it will be, then metabolics begin synthesizing, metabolic reprogramming of every cell will beginning, then after this epigenetic rewiring will be conducting. Then immune response by antibodies. Vaccine-induced immune metabolism processes. The interval between vaccinations, the minimum interval between doses of the same vaccine is 1 month. The minimum interval between administration of live vaccines is also at least 1 month, due to the possibility of interference between them. If you miss the next dose in the immunization cycle, the vaccination is carried out at the first contact with the child without repeating the doses. Multiple vaccines can be administered simultaneously, but in different syringes and in different areas of the body. Contraindications for immunization are almost all contraindications to immunization are temporary and should be dynamically reviewed as soon as possible. Contraindications to all vaccines are a strong reaction or complication to previous administration of vaccines, a high temperature over than 40 Celsius degree, and high-pitched scream for more than 3 hours. Children with allergic disease like asthma, hay fever, allergic dermatitis, and eczema are vaccinated with the exception of polio vaccination during remission. Thank you for your attention.